Hi, okay, we're going to do an instructional video on the oblique lumbar projections. There's going to be two. We're going to do a left oblique and a right oblique. These are going to be done on the table. You may see them at some points being done standing up at the wall, Bucky, but I think Meryl's has it on the table, so that's how we're going to do it. So I'm going to have Mrs. Marshall lay on her back here in the supine position on the table. We're going to use a 14 by 17 with the red line at the bottom. You're going to put it in here, portrait. And then you're going to be detinting your tube for this. And you're going to be at 40-inch SIE. Okay, so what you want to do is you're going to roll the patient's affected side up, and you're going to put a 45-degree long wedge sponge underneath them to kind of hold them in place. So I'm going to go ahead and roll Mrs. Marshall up towards me. I'm going to put this sponge right behind her and then roll her back. Okay, and then she can just rest her arms down by her side so that they're not in our picture. You're going to have her straighten her legs out, and then just make sure that your patient's pretty straight. No crossing your legs, ma'am. Okay, and so then you're just going to center on the side that's up. And basically you're just getting an oblique projection. You guys will probably learn, if you haven't already, about seeing the Scotty dogs. That's what you're going to be looking for on this image. So in order to see what it looks like, you may want to look in your Meryl's book to see what the image actually turns out like. You're going to center, depending on where you're looking, if you're looking up at the lumbar region, you're going to center about 1.5 inches above the crest. And if you're looking down like L5, S1, then you're going to center about 2 inches below the crest. So it just kind of depends on the exact spot that you're looking at. And then usually what I do for centering is I kind of feel for where the belly button is, and I go about 1.5 to 2 inches over. So you don't want to be all the way over here because you're going to miss the spine. The spine's right here. But you also don't want to be all the way over here because then you're going to miss it. So you want to make sure you're kind of looking in your mind where the patient's spine is, and that's where you're centering. And you got to remember your patient is rolled up. So their spine is not going to be in the midline of their body. Okay? And then you can collimate in pretty good because your spine is not that wide. And you're going to mark the side that's up. I put those somewhere where I wouldn't forget them. There. And I'm just going to mark right down here at the bottom in the corner. And I'm going to set my technique at 90 kVp, and I'm going to have my patient take a big breath in, let it out, and hold it out. Okay, and then we're going to do the other side, which is exactly the same thing, but we're going to have her roll the opposite direction. So I'm going to have her roll up and then back on the sponge, and then straighten your leg out. Okay, then you're going to again make sure your patient's nice and straight. Straighten the leg out, ma'am. Okay, you're going to feel for the crest, go about 1.5 inches above, and then you're going to go in, go for the belly button, and I'm going to go just a little bit lateral of that. And my collimation's actually in good shape. And I'm going to put my marker on the right side because that's the side that's elevated. And I'm going to expose this at 90 kVp, and she's going to take a big breath in, let it out, hold it out, expose. And get this out of your way. And that is the oblique lumbar projection.